Hi, Kevin Henry, the Group Editorial Director for Advanced Star and Dental Products Report, and I'm on a Google Hangout today with our EHR editor and my friend Mike Uretz. Hey, Mike, how are you this morning?
Hey, Kevin, how are you doing?
Hey, all good, all good. Just want to follow up with you on some. Next week, you're going to be presenting at the CDA meeting in Anaheim. Congratulations on that. That's always a cool thing.
Oh, thanks.
Yeah, and I love the fact that California, and we just posted up an article how California and Minnesota are really kind of taking that lead as far as educating dentists on where EHRs are and where they're going. So why do you think California decided that now was the time to talk to their members about EHRs?
Well, by the way, Kim, before we start, I want to say that was a really great article you guys had on the education. You know, I do a lot of workshops and things, and I really appreciate you getting the word out about EHR education. Anyway,
we want to be on the cutting edge like you.
To answer your question, it's real interesting because I actually started a conversation with California probably over a year ago about electronic health records and education related to health records. And we've actually been conversing for about a year. And all of a sudden, the last couple of months, I mean, I've been doing a lot of things with them. For example, I wrote some checklists. I wrote a little piece for new dentists about EHRs. And I think that I met with the practice management group, and they seem fairly visionary for Dental Association in terms of recognizing where dental software is going, where electronic health records are going. And I think just as you do at DPR, there's a recognition that all this stuff's starting to pop.
So tell me a little bit about your workshop. What can attendees expect? What are some of the topics that you cover?
Well, I'm really excited about this because I actually have a whole 3 hours, so I can get a lot done. And basically, what I'll be talking about is first, obviously, because this is so new, I'm going to talk about a lot of the features and functionality, all the next generation features that you'll be seeing in EHRs, which probably dentists haven't even thought about or seen. And so I'll be educating a lot about what to expect from a clinical and administrative viewpoint. Then also I think it's really important to go into how to actually evaluate and select the technology, as well as negotiate contracts and do implementations, because as you know, once you decide on the technology, there's a whole road to follow to make it successful. So pretty much I'm going to attempt in my 3 hours to do a soup to nuts approach to how to select, purchase, and implement dental electronic health records.
And personally, I can tell you the cool thing is I can hear the excitement in your voice, and I know that excitement's going to translate over into your talk in California. Just talk a little bit about why you're so excited to kind of see this revolution finally happening in the dental sphere.
Well, for me personally, it's interesting because, as you know, I've been involved with electronic health record technology for about 14 years now. And, 4 years ago, I actually wrote a piece called The Deja Vu of Electronic Health Records for Dentists. And it never really had any traction. I was trying to really alert the dental industry to where this industry is going, EHRs and dentistry. And the last year or so, I started seeing more and more traction. The excitement for me to see folks like California Dental Association, Minnesota Dental Association, and I just did some workshops for the Academy of Oral and Maxillofacial Surgeons to see these folks really embrace this and try to educate their members. Finally, it takes a while to do anything, right? And finally, seeing all this happen is just really exciting for me.
And I know you and I have talked a lot, and you feel like we're on that cusp as far as the EHR goes. And I know you just wrote an article for us about the 10 reasons why your dental practice is going to be using EHRs. Can you talk a little bit about, maybe expand upon that article a little bit, just kind of talk about why you wrote it?
Sure. Well, obviously, there's a lot of detail in it. So in the minute we have, I can't go into all the detail of the article per se, but what I can say is that the reason I wrote it is because there are a lot of drivers that are really pushing the dental industry towards going to dental electronic health records. The government is getting involved with healthcare, as you know. There's a lot of new technologies that are helping it. Just patient care and patient safety, and actually a lot of new features that help administration. So really, again, I think it's important. I hope folks read that article because it really points out some of the main drivers, so folks can really see that this isn't just something in the future, but this is happening now.
Absolutely. Be sure to check here on Dental Practice Management. There's actually a link further up in this article that we've linked this video to get to Mike's article on the 10 reasons why dental practices will be using EHRs in the very near future.